Hey everyone, today I'm going to be talking with you about health literacy. The objectives for this presentation are that by the end, the learner will be able to define health literacy and will be able to discuss its effect in current nursing practice. The learner will be able to identify how health literacy impacts healthcare. And last, the learner will be able to recognize and identify how health literacy impacts society. So what is health literacy? The definition is the degree to which individuals can obtain, process, and understand basic health information and services they need to make appropriate health decisions. So how is this relevant? Over 75 million Americans, which is approximately 36%, have low health literacy, which can lead to poor patient outcomes and financial burdens. And only 12% of adults are considered to have proficient literacy skills. So that is a very small number of people that actually understand health diagnosis, their medication, understand what's fully going on with them. And I included that picture there because I think makes a great point. Just because patients can read does not mean that they will be literate and will automatically understand what's going on with them. So what is the influence on nursing practice? As nurses, we're constantly educating patients on medications, procedures, lab results. The list really goes on and on. Therefore, as nurses, we must be aware of health literacy and should be testing patients in order to perform effective communication and create positive patient outcomes. And there are several tools that are available that are listed below. The Rapid Estimate of Adult Literacy in Medicine uses health-related terms only and takes about 2 minutes to perform. However, it only measures reading skills and not comprehension, so it might not give a very accurate idea. The Test of Functional Health Literacy in Adults measures comprehension but takes about 20 minutes to complete. It's a very reliable test, but let's be honest, most of us don't have 20 extra minutes within our shift. And then the newest vital sign only measures comprehension and takes 3 minutes, but is not nearly as reliable as the one above, the Test of Functional Health Literacy in Adults. So research has also shown that regardless of one's health literacy skills, education level, age, or socioeconomic status, that everyone benefits from easy-to-read resources. So maybe instead of performing one of the tests for health literacy, just by providing easy-to-read education resources, the patients will really benefit from that. And utilizing the teach-back method, it gives a clear sense of what patients and or family members were able to retain. And then as nurses, we can also recognize the at-risk populations for low health literacy. Limited health literacy is higher among older adults, ethnic minorities, individuals with lower education levels, and people with chronic diseases. So what is the impact on healthcare? Low health literacy can lead to high healthcare costs. It is estimated that the costs can be anywhere from between $1 to $3 trillion each year. So that's a whole lot of money. And it can also lead to frequent hospitalizations and ER visits, which I think is pretty self-explanatory. If people aren't understanding what's fully going on with them, they're going to come back to the hospital quicker than somebody who does understand how to take their medications and follow-up appointments and all that stuff. Nurses have a professional responsibility to teach patients effectively and evaluate their understanding of health information. The American Nurses Association states that nurses are to use health promotion and health teaching methods appropriate to the situation and the patient's developmental level, learning needs, readiness, ability to learn, language preference, and culture. Therefore, it is our duty to make sure we are presenting information in a way that our patients will understand so that they can take the information and make sound decisions regarding their care. And then because of this, emphasis was placed on teaching nursing students on healthcare literacy and its effect. There was research that was done recently that suggested that nurses feel and understand that it's their duty to assess their patients for health literacy, but many lack the formal training. So there has been a big push recently and a lot of research being done on the effects of teaching nursing students. The impact on society. Society feels the greatest impact because they are the ones who are our patients that we treat and are educating. So they are really feeling the the burden from this. Financial effects on everyone. I know that was mentioned in healthcare, but also affects everyone through increased insurance costs or unnecessary tax dollars being spent. Medication errors. If patients are unable to understand medication information, they will be more likely to perform medication errors or may miss doses, creating poor outcomes. I have personally seen this. I work on the congestive heart failure floor, and a lot of times patients will come back to us because they will be taking their Lasix pills as needed or when they feel like it, instead of taking it every day or twice a day as they were instructed to do. And this can be very dangerous to patients and can lead to very poor patient outcomes. And there's also a greater risk of death. A study was performed following hemodialysis patients for 3 years, and it was found that patients with low health literacy levels had a 54% higher risk of death compared to those with adequate scores. So that's a pretty significant statistic there. So how can we improve health literacy? Using clear, concise communication, familiar concepts, words, numbers, and images, short sentences, using font size greater than 12, use color sparingly. Black and white is usually the way that we can read information the easiest. Break up paragraphs into shorter sections, utilize bullet points, and most importantly, I think, is train staff on recognizing and improving health literacy. So in summary, only 12% of the American population is considered to be literate. Low health literacy can have detrimental effects to the patient because it leads to poor patient outcomes, but also to healthcare facilities due to costs and frequent rehospitalizations. Screening for health literacy among patients and providing education that is clear, concise, and plain language will have a positive impact on both patients and healthcare organizations. And it is our duty as nurses to ensure that patients are receiving education in a way they will understand so that they can make informed decisions of their care. That wraps up my presentation. I'm going to take you to the reference slide. Thank you all for watching.